Hey everybody, this is Andrew,
Maddie and Heather.
and today we're going to be discussing the relationship between drug abuse and dentistry. Our objectives for this presentation are to review the effects of different drugs of abuse on dentition and the oral cavity, analyze the issue of opioid overprescription in the US and how dentists play a role, and to go over management and treatment of drug users.
Alcoholism is very prevalent in the US. In 2018, there were 14.4 million Americans, roughly 5.8% of the population, diagnosed with alcohol use disorder. The contents of alcohol that affect oral health are the alcohol's acidity, sugar content, usually in mixers, sodas, juices, beers, wines, dry mouth. Alcohol dehydrates the body, which leads to less saliva and causes a buildup of bacteria and plaque. A lack of good oral hygiene, whether it be brushing or flossing or dental cleanings and checkups, and bad eating habits, so nutritional deficiencies and things like that. Studies show that alcoholics have a higher prevalence of enamel erosion, dental caries, periodontitis or gum disease, which has been linked to irritation of gingival tissue, and mucosal lesions. Oral health is drastically affected by tobacco and e-cigarettes as well. It contains thousands of carcinogenic substances that can lead to many oral cancers such as mouth, pharynx, larynx, esophagus, and lip. It's been linked to high rates of tooth abrasion and caries. Many users experience precancerous lesions too. Tobacco use has a significant risk factor for periodontal disease and tooth loss as well. That's because you have increased pocket depth, loss of periodontal attachment, and even alveolar bone. So the oral effects of e-cigarettes and vaping are pretty similar. The nicotine content actually restricts the blood flow to the gums. It changes oral cavity microflora. Enamel soft tissue damage from propylene glycol, so that's the main ingredient in most vape juices, and inflammation in the mouth. Cocaine is a powerful additive stimulant drug made from the leaves of cocoa plants native to South America. It's a stimulant that results in vasoconstriction, so dentists such as ourselves will have to be careful using epinephrine in local anesthetics because of this. It leads to reduced oxygen to organs and can also cause a perforation of the nasal septum and the palate, which is seen here on the right. Regular cocaine use may have several orofacial effects, such as the gingival lesions, erosion of tooth surfaces, bruxism, so the grinding of their teeth they just unconsciously do, xerostomia, which is dry mouth, a lot of drugs cause this, and also periodontitis. Methamphetamine is a powerful, highly addictive stimulant that affects the central nervous system. It was developed early in the 20th century from its parent drug, amphetamine, and was used originally in nasal decongestions and bronchial inhalers. Like amphetamine, methamphetamine causes increased activity and talkativeness, decreased appetite, and a pleasurable sense of well-being or euphoria. It's also been used to treat ADHD and narcolepsy. The oral health side effects of meth are substantial. As you can see here on the right, there's meth mouth. It usually comes with blackened, stained, rotting, crumbling teeth that are falling apart. Users experience rampant tooth decay and dental caries caused by the acidity of many chemicals, lack of oral hygiene, xerostomia, so dry mouth, which reduces the amount of saliva that's normally a protectant. Users experience grinding and clenching of teeth again, so bruxism, and their eating habits can usually change, so malnutrition and deficiencies occur. A study published in the Journal of the American Dental Association, including 571 users, showed that 96% had cavities, 58% had untreated tooth decay, and 31% had 6 or more missing teeth.
The final drug we will be talking about is opioids. The CDC defines an epidemic as the occurrence of more cases of disease than expected in a given area or among a specific group of people over a particular period of time. Some interesting statistics is that the US consumes over 75% of the world's prescription drugs and has the highest rate of opioid abuse in the world. The outbreak of opioid abuse is listed as a top 5 public health challenge by the CDC, and approximately 20 million US citizens struggle with opioid abuse. Every single day, 115 US citizens die from opioid overdoses. So as an inferred question, why is this not getting more attention? Opioids cause decreased salivary flow, and the majority of addicts also have poor hygiene and high sugar diets. The combination of these three things results in increased risk of caries, which often do not get treated. Most opioid users have missing teeth due to severe infections, and almost all lack a healthy periodontium. The image on the left shows a heroin addict before and after recovery. You can see that he's gained a lot of weight and that some facial features of his have changed dramatically. And on the right, these are images taken from a case study where you can see the effects of long-term opioid use on dentition. So the effects of opioids on dentition perfectly transitions into the overprescription of opioids, which is a huge problem in dentistry. Dentists prescribed on average 12% of opioids in the United States. This number does change depending on the study that you're looking at. In a study conducted by the University of Chicago, people were asked, who prescribed your opioids most recently? And 23% of the participants answered a dentist or oral surgeon. So this number does vary, but on average it's 12%. And around 2/3 or 67% of all opioid overdoses involve synthetic opioids. Dental patients are specifically vulnerable to opioid abuse because they regularly have leftover opioids. Considering that these are free to the insured consumer, many of them may be tempted to sell their leftover medications to abusers for large profits. It's clear that this is going on. 20% of oral and maxillofacial surgeons in the US prescribe excess amounts of opioid after wisdom tooth removal. A lot of these statistics may seem scary, and they definitely are, but a strong effort has been made in recent years to address the problem of overprescription. The prescriptions have shown significant decreases as a result of physician awareness and policy implementations. I just want to point out this graph on the right, and it's a graph comparing the likeliness of continuing to use opioids with the percentage of people. So you see that after 4 or 5 days, the likeliness of dependency spikes. So if you're prescribed 30 hydrocodones, your likeliness of becoming addicted to it is rather high. To talk on this subject more, I interviewed with Dr. Timothy O'Brien, a certified oral and maxillofacial surgeon. And I took some good quotes from him. He said that in his residency, it was very common practice for all of them to prescribe at least 30 hydros or oxys after wisdom teeth removals, regardless of the patient's history, size, or pain tolerance. Now, he only prescribes 10, and he suggests that if they need more than that, it almost always indicates an issue with the procedure. But he does state that he's one of the conservative surgeons. Most oral surgeons in his practice continue to prescribe 20 to 30. When I asked why people overprescribed opioids, he responded that it was easier to overprescribe and that patients like you more. They come into the office with the expectation of getting a lot of drugs, and many of them are unhappy when that expectation is not met. He said that the quality of your care is often evaluated based on how much pain your patients feel. He also stated that the problem of overprescription is getting better. When I asked why, he said that a rise in overdoses has caused dentists and surgeons to get a lot of bad unwanted press, and the field has changed their policies because of that. The education has improved, and he said that every year, oral surgeons are required to take a short course on opioid safety. When I asked what he does after a wisdom tooth removal, he said that he usually educates the patients and/or their parents on the risk of opioid addiction and how quickly it can occur. As said in the previous slide, it can occur within 4 to 5 days. High-dose ibuprofen works wonders, yet it's often overlooked by patients and physicians. Something interesting, he said, is that they have also recently come out with a long-lasting anesthetic that numbs the mouth for 2 days. It's a great option but the downside is that it's $250 and it's not currently covered by insurance. When I asked how he normally recognizes an opioid user, he said that there is a statewide prescription drug monitoring program which collects data on patients' prescription use. This allows physicians to see how often a patient has been prescribed opioids.
So what are some things you as a dental provider can do for your patients? The first thing is to understand that there are PDMPs, or prescription drug monitoring programs, that allow you as a physician to know if any patients that you have coming in may have been prescribed drugs recently or could currently be taking any prescriptions. This will allow you to identify if they may or may not have a drug abuse problem. Understanding the individual needs of your patient is also important. This helps you avoid possible contraindications during treatment, meaning if they're taking any other medications or drugs, you won't give them something that will counteract that. Being aware of the oral manifestations of such drug use is also important so that you can care and treat for the oral issues associated with that drug. You'll also be able to refer a patient out if they so desire. Establishing good rapport with your patient can reduce the need for prescribing post-operative pain medications. So understanding their needs, again, is very important. If you're able to talk to them openly, this can encourage the patient to continue to come back to you for their needed dental care. Another thing you can do is attend CE courses or continuing education courses to further educate yourself on the ever-changing world of dentistry. As we've said, as dentists, you are always learning. So it's important to understand yearly the changes that are associated with these different topics. Lastly, have general knowledge on local drug abuse agencies in your area, so that if your patient does need any extra help, you're able to refer them to such places. So to wrap things up, I'm going to talk to you about an interview that I had with Dr. Bob Flint, another certified oral and maxillofacial surgeon. Now keep in mind that the best way for a lot of dentists to treat this kind of stuff is going to be very personal. The best thing you can do is find a method that works for you and to stick with it. That being said, here's some things that Dr. Flint went over that he thought should be critical in what you do with your patients. First off, you want to get to know your patients. Familiarize yourself with each individual patient so that you can decide the best course of action in their dental care. It will also help you decide whether you think they need prescribed drugs, and if they do, whether or not you think they might misuse those prescriptions. Another thing he said was that if you know that a patient struggles with drug abuse, you should be vocal about it. Your voice can be a powerful tool for you. And he said in his experience that most patients appreciate when you're trying to help them out, and that if you are vocal about something like that, they may want to seek help more. So he also emphasized knowing about those different local agencies that we touched on earlier so that you can refer them out and so that they have options. Make sure that when you do talk to them, you are clear about how much you're prescribing them and be firm in telling them that that is all they will get. You have to be willing to be able to tell them no if they ask for more. Dr. Flint also mentioned that it was worth noting that prescriptions can't be made over the phone anymore. So it's good that you talk to your patients firmly when conversing with them face-to-face about these prescriptions, and make sure that if they or you are concerned they have a drug abuse problem, that you speak, again to reiterate, both firmly and clear with them about these prescriptions. Lastly, and this should go without saying, he said, do not keep drugs in your office. He says most providers do not, but there are some cases that he's heard of where the drugs were kept in the office and it just led an invited confrontation with the patients into the workplace, which is never what you want. So to finally wrap things up, we're going to ask you guys some questions that will be on the final. First question, what percentage of the world's prescription drugs does the US consume? Is it A, 57.5%, B, greater than 120%, C, 72%, or D, greater than 75%? I'll give you a moment to answer. You guys probably guessed it right. It is D, greater than 75%.
For our second question, what is a PDMP? A, post-distress menstrual period. B, prescription drug monitoring program. C, probable drug misuse patient. Or D, program data management plan. Yep, it's B, prescription drug monitoring program. Here's our bibliography. Thanks for watching.